Welcome to Mindful Objective, the podcast where we explore the root causes of modern health concerns and practical solutions from an integrative lens. I'm your host, Dr. Daniel Sproul, integrative health practitioner and professor. Today's episode's about heavy metals and detoxing. So if you're struggling with fatigue, brain fog, gut issues, hormone imbalances, skin problems, or just feel like something's off, this episode could offer clarity to what you're missing. As always, this show's for educational purposes only. We do not diagnose, treat, or cure any illness or disease. Let's kick off this episode by breaking down something you probably heard of, but maybe never really thought about, and that's heavy metals. These aren't the same as minerals in your body like iron or zinc. So when we talk about heavy metals in context of health, we're referring to toxic metals, and these can accumulate in your body and silently disrupt your health, sometimes years before symptoms actually show up. Some of the most common toxic heavy metals include mercury, lead, arsenic, aluminum, cadmium. These metals are found far more in places than people realize. Mercury can show up in certain fish like tuna or swordfish, or silver-colored dental fillings. Lead can be present in old homes, pipes, even imported toys, or even ceramics. Aluminum's in antiperspirants, some cookware, certain over-the-counter medications. Arsenic can be found in conventionally grown rice, non-organic poultry, and cadmium is often present in cigarette smoke and some processed foods. Your body's never designed to handle this kind of exposure, especially not chronic, low dose on a daily basis. Yet this is exactly how most people are affected. It's not a one-time high exposure, but through regular contact over time. That's where the problem lies. What happens when heavy metals accumulate in the body? They can lodge themselves into tissues like the brain, liver, bones, fat. And once they're there, they don't just sit quietly. They interfere with the way your body runs at a cellular level. For example, mercury can disrupt important minerals like selenium and zinc, which are needed for immune and thyroid function. Aluminum can be studied for its possible links to neurological decline. Are you starting to forget a lot? Is it a high amount of aluminum in your body? Cadmium interferes with kidney function and mineral absorption. Lead disrupts nerve signaling and can damage virtually every organ in the body. When these metals interfere with your biology, the symptoms don't always look obvious. That's when many people miss the connection. Here are just a few symptoms that may link to heavy metal buildup. Brain fog or memory issues. That's our most common. Another one would be chronic fatigue, even with a good night's sleep. Anxiety and mood swings. Hormone imbalances, including thyroid dysfunction. Digestive issues and food sensitivities, skin problems like rashes, breakouts, headaches or migraines, muscle aches, joint pain. None of these symptoms are exclusive to heavy metals, right? But they often present in cases of toxicity. The danger is that they're frequently misdiagnosed or treated symptom by symptom without ever looking for an underlying cause. And here's something important to understand. Most conventional medical labs don't routinely run this test of heavy metals unless you're dealing with acute poisoning. That means many people often go undiagnosed for years, treating the downstream symptoms while the root cause, which is a toxic burden, remains. And this goes on, could be forever. Most medical doctors never test for heavy metals. That's where integrative health comes in. We look deeper. We ask questions like, could these symptoms be connected to an environmental toxin? What kind of detox pathways does this person have? Are they eliminating toxins efficiently and retaining them? Is your body showing signs of mineral imbalances that might signal heavy metal competition? That's why we're such advocates for testing and safe detox strategies. If you've been chasing chronic symptoms that just won't go away, it's worth considering that something deeper could be affecting your body's ability to heal. In this episode, we'll walk through how to test for heavy metals using a tool called HTMA. That's the most common, hair tissue mineral analysis. What's a safe detox look like, and how to support your body before, during, and after. We'll also introduce you with different kind of tools we use here when it comes to detox in our practice. Before we get there, let's dive into how testing works, because you can't fix what you haven't identified. Next, we're going to talk about hair tissue mineral analysis, how it works, what it tells us, and why it's one of the most useful tools we have in identifying hidden metal toxicities. But how do you actually test for them? How do you find out if metals like mercury, arsenic, aluminum are lingering in your system? A lot of people do not know. That's where HTMA comes in. Hair tissue mineral analysis. It's practical, non-invasive, and affordable. It's a good way to assess mineral imbalances and toxic heavy metal exposure. Let's break that down even further. Hair tissue mineral analysis, HTMA, it works by analyzing a small sample of your hair, usually taken from the base of your scalp to the back of your head. Why hair? Get that question a lot. It's because hair is a storage tissue for minerals and metals. As for your body works to eliminate toxins, it pushes some of those metals into the hair for excretion. This is important to understand. Blood is tightly regulated by your body. Your blood values might appear normal even when something's seriously off. Because your body fights hard to maintain balance in the bloodstream, hair, on the other hand, shows what your body is trying to get rid of. It gives us a longer-term picture, like a timeline, and what's happening internally. HTMA test can reveal two key categories. One would be essential mineral levels and ratios. This would be magnesium, calcium, zinc, potassium, sodium. Then also toxic heavy metals like mercury, lead, arsenic, aluminum, cadmium, but it doesn't stop there. One of the most powerful aspects of the HTMA is the ability to see patterns that include how your body's functioning overall. For example, are you burning through magnesium too fast due to chronic stress? Is your calcium level too high, indicating sluggish thyroid activity? Are your sodium potassium levels imbalanced, pointing to adrenal fatigue? Are you holding on to toxic metals that block mineral absorption? This is incredibly valuable information that helps us move beyond guesswork. Here's another thing great about HTMA. Again, it's non-invasive. No needles, no blood draw, completely painless, unless you hate having your hair cut. Long-term insight, it reflects what's happening in your body over a few months, not just what's happening today. Another thing, it's cost-effective, much more affordable than running a series of specialized blood tests. It's easy to collect, so you could collect a sample from your home and mail it in. At-home tests, very nice and easy. Another thing, it's safe for all ages, especially useful for children who may not tolerate blood testing well. Now let's talk about what happens after you get your results. From the lab, we'll get a detailed report, and we just know that's the starting point. At our practice, we go far beyond just handing you a lab result. We walk you through the entire process so you understand what the results actually mean for your health. We look at the toxic metal levels, of course, but we also examine mineral ratios like calcium to magnesium for muscle and nerve function. Zinc to copper, this is a lot of times used for immune and hormone balance. Sodium to potassium for adrenal health and electrolyte regulation. If metals are elevated, which I would say every single report I've seen had heavy metals, especially aluminum and mercury. It's pretty common. But at that point, we determine whether your body is currently excreting them or if they're just trapped in a tissue. At that point, that helps us decide what and how we're going to introduce you to a detox support. And if the mineral levels are off, we focus on replenishment before doing any heavy metal detoxing, right? We don't want to stress the body even more. This is a big part of what makes our detox protocols more effective and more gentle than a one-size-fits-all approach. Another benefit of HTMA is it allows us to monitor your progress over time. After a few months on a personalized protocol, we can retest just to see how well your body's detoxifying and where it needs additional support. Maybe the support you're doing with the proper minerals and so forth. Are you taking a supplement for minerals, and on the other side you're doing a detox? Are you doing a detox via a sauna? Or there's other ways to do things out there. So we like to look at that and retest later on in life. That could be 90 days, 6 months, a year, whatever it is, whatever we decide. But we want to see how your body's adjusting to that detox. So again, if you've been struggling with chronic symptoms and conventional labs keep telling you everything looks normal, which we hear all the time, HTMA might be the tool that finally provides you with some answers. It helps connect the dots between fatigue, brain fog, anxiety, digestive issues, and even skin problems, all which can be tied to mineral imbalances and heavy metal burden. By now, you understand what heavy metals are, but what happens once you find out you have elevated metals and mineral imbalances? That's where most people make mistakes. They jump straight into aggressive detoxes. You see them all over different forums where people give blind recommendations. Oh, do this detox, do this, take this. And again, that's where most people make mistakes. Using harsh chelating agents or high-dose binders without proper preparation, not good. The approach often leads to headaches, fatigue, digestive distress, or worse. But why? They're stirring up more toxins without supporting the body's ability to get rid of them. You're just burdening your body even more. That's why we always use a structured 3-phase approach at our practice for heavy metal detox. This ensures your body can safely eliminate what's being released without unnecessary side effects. You already have side effects. Why do you need more? So let's walk through it. Phase 1, this is to open the detox pathways. Before you even begin mobilizing metals, your detox organs need to be functioning optimally. That means your liver, kidneys, colon, lymphatic system all need to be flowing. If these are backed up, toxins that are pulled out of the tissues can simply recirculate and just get reabsorbed. Now you're wasting money, and plus you're not feeling good and actually going more downhill. To support this, we recommend starting with a universal binder, a blend that's safe, natural binders. It also has detox supportive ingredients in there. This formula includes bentonite clay, which binds to the toxins in the digestive tract and supports gentle elimination. Activated charcoal. This acts like a sponge to metabolic waste and environmental toxins. Apple pectin. This encourages bowel regularity and healthy gut motility. Humic and fulvic acids. These nourish cells and support both detoxification and nutrient delivery. Tudca and taurine. These support bile production and open liver pathways, helping the body safely excrete fat-soluble toxins. The goal in this phase is simple. Get your body ready to detox. We often spend at least 2 weeks here before moving into the next stage. Phase 2, break down biofilms. Here's a lesser known fact. Heavy metals and toxins often hide behind biofilms, same like candida. They're slimy protective layers created by harmful bacteria and fungi. Biofilm makes it harder for your immune system. That's why we include fluorofilm. This is a powerful enzyme blend specifically formulated to help dissolve those biofilms. When you remove these barriers, you allow the detox goal immune defenses to work more efficiently. Fluorofilm includes enzymes that target the protein, sugar, and fat components of biofilms, helping to expose hidden microbes and toxins for removal. This also supports gut health, as biofilms are a major reason why candida and bacterial overgrowth can become persistent problems. Then the next would be phase 3. You want to mobilize and remove those heavy metals. Once your body's prepped and the biofilms are addressed, it's time to start the show. And that's the heavy metal detox formula. This supplement has a special blend of herbs known for chelating and detox supportive properties. Key ingredients: chlorella. You hear a lot about that. It's a powerful algae that binds to mercury and other metals in the gut, helping prevent reabsorption. Cilantro, known for its ability to mobilize stored heavy metals from tissues. Spirulina, it's another nutrient-dense algae that supports immune health, detox, and antioxidant activities. Bladderwrack, this is a seaweed rich in iodine and trace minerals, helpful in displacing halogens like fluoride and bromide. Dandelion and milk thistle. These are herbal powerhouses that support liver detox and regeneration. It also protects your system while it works hard to eliminate toxins. This combination is gentle but effective. We don't force a detox, we support your body's own rhythm, which is the safest and most sustainable approach. During this phase, we closely monitor your progress and adjust a protocol based on how you're feeling, how your digestion is working, and how your body's responding. For some people, a detox process lasts several weeks. For others, it's extended over months with breaks and check-ins along the way. Let's talk about why it works. The reason this method is so effective because it's not just a removal, it's about rebuilding. You're not only getting rid of what's harming your body, you're also restoring what's missing: minerals, nutrients, and your overall balance. We don't use synthetic chelators or extreme detox kits many you see online. It's just garbage. Our approach respects the complexity of your body and works in harmony with your system. It's customizable, safe, and backed by experience and science, not just theory. Do you need heavy metal detox? And what the signs are you might be missing? By now, you're asking yourself, how do I know if heavy metals are the problem for me? It's a great question. And the truth is, most people with heavy metal burden don't know until they start putting the puzzle pieces together. You finally stop guessing and start testing. So unlike a broken bone or a sudden infection, heavy metal toxicity usually builds up slowly. It's a silent stressor, one that can gradually disrupt your body system over years or even decades. That's why symptoms are often vague and dismissed as aging, burnout, and a common one is just stress. Let's go through some of the most common signs and symptoms that may point to hidden heavy metal tissue. Keep in mind, none of these symptoms confirm toxicity on their own, but when you see patterns or clusters, that's when you start to know that we need to dig deeper. If you're waking up tired, hitting a wall in the afternoon, or feeling like your body just doesn't recover no matter how clean you eat or how early you go to bed, obviously something deeper is going on. Metals like mercury and arsenic damage the mitochondria, the energy factories of inside your cells. When your cells can't produce energy efficiently, you feel drained, foggy, and worn out. Your brain's especially sensitive to heavy metals. Mercury, lead, and aluminum can interfere with neurotransmitters and damage nerve cells. If you struggle to concentrate, forget words mid-sentence, or feel like your thoughts are slower than they used to be, it's worth exploring heavy metal exposure as a potential factor. Anxiety, mood swings, irritability. Is it not just you're not getting enough sleep, not enough food, but what if it's heavy metals? While mood issues can be caused by many things, of course, heavy metals contribute to emotional instability by altering brain chemistry and hormone signaling. If your anxiety comes out of nowhere or your moods feel erratic or hard to control, mental toxicity might be involved, especially when it's paired with other symptoms. Another one would be skin issues. Your skin is one of the largest detox organs. When internal detox pathways are overwhelmed, such as your liver or lymphatic system, your body may push toxins out through the skin. This can show up as acne, rashes, itching, eczema like flares, even with people with no previous skin problems. Another common is digestive struggles and food sensitivities. Heavy metals can contribute to gut dysbiosis or imbalance in gut bacteria. They can feed harmful organisms like candida, they can weaken your gut lining, and they can make you more reactive to different foods. I've been there. If you suddenly develop food intolerances, have frequent bloating, or alternate between constipation and diarrhea, this could be part of the picture. Another one would be hormone imbalances. Metals can interfere with your endocrine system by mimicking or blocking natural hormones. Cadmium and mercury, for example, are known as endocrine disruptors. Symptoms can include low libido, irregular periods, worsening PMS, difficulty losing weight, or symptoms of thyroid dysfunction, especially if your labs look normal, but you still feel off. Another common one is if you have a history of exposure. So even if you don't have obvious symptoms, your history does matter. Some common source of exposure include those aluminum fillings, those dental fillings. Another one would be frequent consumption of high mercury fish like tuna or swordfish. Living in an older home with lead paint or old pipes. Smoking or secondhand smoke exposure. Are you still sitting in the smoking section in your restaurant? That's for us older people. A career in beauty, manufacturing, or construction. Using aluminum-based deodorants or cookware. Or it could be routine vaccines with aluminum adjuvants. It's one or more of these apply to you. It's worth considering that heavy metals may be building up silently. Let's talk about now why conventional testing often misses this. Blood work doesn't always show heavy metal issues. That's because metals are often stored in tissue, not circulating in the blood at the time of the symptoms, when those symptoms show up. You may be told everything's normal while metals continue to disrupt your health behind the scenes. That's why we rely on the HTMA testing to reveal what's happening at the cellular level. And once we have these patterns, we can guide you through a protocol tailored by your body needs, one that's gentle and supportive. But going back to the clinical side, how often have you walked in and you're telling your medical provider, I'm having these symptoms, and they tell you, oh, it could be heavy metal exposure. Let's do a heavy metal test. Never. You'll never hear that. So bottom line, if you're chasing unexplained symptoms, running tests that come back fine, or feeling that your body isn't functioning the way it should, you owe it to yourself to look deeper. Heavy metals may not be the only issue, but in many cases, they're a missing piece that connects everything. And that's why I always tell people, let's test, right? A lot of times we'll talk based on your health history, but oftentimes we say, let's run that lab work, blood work. The next thing, food sensitivity test, see where you're having food issues. Organic acid test, or gut problems, neurotransmitter issues. Then we say heavy metal detox. How is your heavy metals? Are you having these symptoms because of your stomach and because of heavy metals, or the heavy metals causing the stomach issue? But you won't know until we go through these steps. Then another thing is omega-3 testing. Let's understand your inflammation level. That's out there too. What's your long-term strategy? Everything we do should be long-term. Again, detox isn't just a box you check. It's not a 7-day juice cleanse or a temporary trend. When it comes to heavy metal detox, it's about rebuilding your health from the inside out. And you want to create a long-term strategy that helps your body stay clean, supported, and you want to be resilient. What happens after you've gone through a detox protocol? That's where the real work begins. The post-detox phase is about maintaining the gains you've made during preventing the re-exposure that could push you back into toxic territory. You don't want to go backwards. So let's talk about what it looks like at our practice. Step 1, replenish what's lost. Heavy metals don't just sit around passively. They compete with and displace other minerals in your body that your body depends on. Minerals like magnesium, zinc, calcium, selenium. During detox, these essential nutrients can be depleted even further. That's why one of the most important parts of recovery is mineral replenishment. Without it, your cells remain underpowered and vulnerable to stress, inflammation, even fatigue. Some of our go-to options include magnesium glycinate or malate. These support relaxation, energy, and sleep. Zinc for immune function, hormone balance, skin repair. Trace mineral blends that include elements like boron, molybdenum, chromium would be another one. These support your metabolism and detox enzymes. This is where HTMA shines. By retesting every few months, we can show your mineral landscape has changed and adjust the supplements accordingly. Do you need more? Do you need more magnesium? Do you need more boron? What is it specific to you? And at that point, that's when we could tweak during that recovery and maintenance phase. We can understand at that point, hey, I'm still having this issue or this issue, or maybe my body's not absorbing this and it needs more. And that's okay, but we need to look and discuss it. Step 2, keep those detox pathways open. Even after you finish your core detox protocol, your body still encounters toxins daily. This could be through air, water, food, even stress. That's why we keep your detox pathways open, which is critical. Want to support your drainage organs with these simple, sustainable habits. Hydrate constantly. Drink a lot of water, ideally with mineral-rich or filtered water. You do not want to drink tap water. We always say reverse osmosis is the best with minerals. If you get filtered water, Fiji, Evian, those are 2 I like. But still, reverse osmosis is one of the best, cleanest, but you want to stay hydrated. So just make sure you're drinking a lot of water because you don't need to reburden yourself by drinking tap water that has these different heavy metals in them when you're trying to detox from them. Other thing, move your body daily. Even if it's a brisk walk or gentle stretching, movement keeps your lymphatic system flowing. Prioritize regular bowel movements. Detox can't happen if the waste isn't leaving your body. Are you backed up? That's not healthy. One thing we do here is we utilize a universal binder, which is perfect for this. It's gentle and contains the right herbs to keep bile and liver flowing properly. Some people benefit from occasional use of fluorofilm after antibiotic use or during gut protocols to keep the microbiome balance in check. It's about listening to your body, and you want to use support wisely, not all the time, but when it's needed. And step 3, like we're talking about tap water, you want to avoid re-exposure. So detoxing without reducing your exposure is like bailing water out of a sinking boat. Eventually, you'll be right back where you started. While you can't live in a bubble, you can make small, manageable changes that lower your toxic load long term. Some smart swaps to consider: replace aluminum cookware and foil with stainless steel or glass. Switch to aluminum-free deodorants and natural body care. Filter your drinking water and shower water. You may need that reverse osmosis machine or shower filter or whole house water filter. Choose wild-caught low-mercury seafood like salmon, sardines, or anchovies. Look for organic poultry and rice to avoid arsenic. If you still have silver fillings, consult a biological dentist after safe removal. And a lot of other dentists too are now switching to porcelain. Focus on progress, not perfection. As we always say, things take time and you're not expected to be perfect. And if you're expected to be perfect, you're never going to continue. So take your time on this journey, but change your habits. Step 4, we would say retest and rebalance. Healing is a process. The detox and rebuild cycle is not a one-time event. It's something we revisit as your body evolves. That's why we encourage rerunning an HTMA test every 4 to 6 months during active healing and every 6 to 12 months during maintenance. Helps keep you from flying blind and gives you the confidence to adjust protocols with precision. It helps us also understand new imbalances early before they actually become symptoms. Again, you don't have to figure this all out on your own. In our practice of Mindful Objective, we guide you through every step of the way, from testing to protocols to product support. We help you understand your body, and we want to help you make informed choices without fear, overwhelm, or confusion. Remember, you're not broken. Your body just is being burdened. The goal of the heavy metal detox isn't just to get clean. It's to feel strong, clear, energized, and you want to be whole again. Now let's bring this all together. Heavy metal's a major thing. And it's something that most people do not know about. They hear a lot about heavy metals. They do not understand always what it means or the cause of it. Hopefully you'll learn something through this podcast. And there is another heavy metal podcast out there I created before. This one's more focused on the detox portion of that. But in general, heavy metals play a critical role in our body that we do not hear from a clinical level. You go to your physician, you never hear about heavy metal detoxes or heavy metals in your system or how to even test for heavy metals, what heavy metals are, how they affect your body. But just know we are here for you. So we have these tests. They're not expensive. Yes, it's obviously something you have to pay for to get it going and stuff, but paints a better picture of your health. If you take your health seriously, I highly suggest hair tissue mineral analysis test along with heavy metal detox because, again, 99% of people will show up with some sort of heavy metals from, birth on, vaccines. Is it your water you're drinking? Is it the pollution outside? Is it you work in a warehouse, you're exposed to these chemicals? Are you handling metals all day, touching them? There's a lot of ways to get exposure. So again, people show up higher than others, but you could detox these things. This wraps up this episode of Mindful Objective. As always, this show's for educational purposes only. It's not meant to diagnose or treat any health condition. Please consult your licensed provider before making any health decisions. Again, we provide you with all the labs and reports. You're free to give those to your physician. As we work with physicians too, to kind of identify these issues, educate different physicians out there also, and whatever we can to get you healthy again. If you suspect heavy metals could be contributing to your health challenges and you're simply ready to look deeper, we offer that hair tissue mineral analysis, HTMA testing, customized detox protocols, and also supportive tools for heavy metal detox through Mindful Objective. Be sure to visit mindfulobjective.com for more information, discount on supplements and healthcare products, plus many different functional lab panels. As always, thanks for listening, and remember, your body's not broken. It may be just burdened, and we're here to help. Stay well.